Hello, and welcome to the Nurse Linda webinar today. It's funny how the time just flies by in between webinars when when you have this thing that's coming up and it's at the end of the month and you reflect back on the month. It just seems like time just flew right by. We're entering the colder weather season now, so be sure and remember that your body will react to cold even if you don't feel it. So be sure you wear proper attire when you go outside. Be sure your feet are covered. This is the time we see a lot of people coming into clinics and they've got frostbite on their toes because, they didn't wear shoes and socks and, it's cold outside and they didn't realize. So, be sure and dress appropriately for the weather. It's just critically important to your health because, we don't want any trouble when we can avoid it. It's much easier when we can avoid it. So we have lots of questions today, so we'll get right to them. First of all, there's a question about, and I love this question because it's so to the point, where can I be weighed? And we were talking about this at the foundation just before this came on because this is such an issue for people to find a place where they can be weighed that, can weigh a wheelchair in themselves. So there's lots of places where you can go to be weighed. You'll have to call and make arrangements. Sometimes hospitals will have a wheelchair scale. And if you call like the director of nursing and ask if you can use their wheelchair scale to be weighed in your wheelchair. And then if there's a place where you can transfer into a chair or something just for those few seconds while your empty wheelchair's being weighed so that can be subtracted from your weight with the wheelchair, and then you'll know what your weight is. Be sure and keep, if you have like a seating equipment, pressure injury equipment, or an armrest that comes off while you transfer, or if you have a bag of stuff in the back, be sure that you don't empty that stuff. Weigh the wheelchair with whatever it is plus you in there. And then all you have to do is subtract. But that's a good place to go because most hospitals have a wheelchair scale. And many of them will let you. Sometimes no. So, okay, if you get a no answer, where can you go? And sometimes you can call long-term care facilities in your area and ask if you can come and weigh yourself on there. And they'll oftentimes let you do that. Same process. Another thing that I have had, and please don't be offended by this, but I've had patients do this, where they'll go to a manufacturer that has a scale for weighing their product and ask if you can do the same thing there. Now that's a little bit trickier to find somebody who has a scale big enough to weigh you, but people do that. There are also big scales at recycle places that you might be able to find. Some doctors' offices do have the wheelchair scales now, but you would know if your own doctor had that or not. So that is also another option. So there are places around to get this accomplished. You just have to dig and dig and dig until you find the right place and the right opportunity. Also, I may suggest to you at long-term care facilities, they also have wheelchair showers. So you can ask maybe for a slight fee if you can go in at some off time when they're not showering the residents, if you can use their shower facility. Now that gets a little bit trickier because they will be worried about liability with the water and, who's helping you and who's, somebody has to be there to monitor you and all that, because they have liability issues. But, just see if you can work through all those things, see if you can sign a release. If you have to use a lift to get into one of the tubs, and then how will you maintain your seating in the tub? What will you do about your seating dispersing equipment? So will you be able to take your seat cushion to sit into the tub, or will they have most of them have the roll-in showers, and generally they'll oftentimes let you do that. So there are some opportunities. Now we were just talking about the Abilities Expo, and those come to different cities. It goes around the country. And if you ever get the opportunity to go to one of these, they're really kind of fantastic because they have all these different things that apply to people who have different challenges in life. So they have vans there, accessible vans. They have all kinds of equipment. They have all kinds of pressure dispersing equipment. Sometimes they have scales there where you can get weighed. So that's an opportunity, but they have different organizations. They have presentations. So they might have a wheelchair dance team. Some of them that I go to have had rock climbing, accessible rock climbing. So, there are fun things to do. There's all kinds of equipment. There's all kinds of clothing and shoes and all kinds of things, shoes that open so that you can get your foot in if you have tone or spasms, and your toes curl up and you can't get them into a over-the-counter kind of shoe. So there's all kinds of things. This weekend, as a matter of fact, is in Dallas. So if you live in the Dallas area, the Abilities Expo, it's free. You just have to sign up and say you're coming. And they're just huge. I'll be there on Saturday giving a presentation after lunch. So if you happen to be in town, come say hello. I'd love to meet you. And I do meet a lot of people when I go to these, and each city will have something a little bit different. So the one in California has an accessible bus, an actual bus they drive into the arena. And you can practice getting on and off the bus because in California, they use a lot of public transportation. And so that's really cool. But different cities will have different things that are kind of focused in their area. So there's just all kinds of things. The exhibits are always changing. They have catheters. They have just everything you can think of. So it's really kind of a fun place to go. Lots of families come. Lots of parents bring their children. So it's for all ages, and there's all kinds of opportunities, things to do. It's just really interesting. The Reeve Foundation will have a booth, and as you know, all of their literature is free to you, so you can get it online, or you can stop by the booth and pick up hard copies. So it's always nice. I'll be in the booth Saturday afternoon after the presentation. So Saturday is my day to be there. So I hope to see you there. So that's a wonderful opportunity. So we'll get right into some of the questions. We already talked about where you can get weighed. And so there are opportunities. Now, much like anything, it is a challenge. And you might call and the person, oh, no, we don't do anything like that. Call back. Talk to a different person, just kind of wiggle your way around and see. Usually the scale is not too much of a issue for people at different organizations. That's not such a liability. Showering can be kind of a bit more of a liability, but it can happen. So think about that. Maybe they'll charge you a little fee, or I don't know, there's all different kinds of arrangements. So I'm not in the business end of that, but anyway, people do that in a lot of different places. There's a question here about who to go see to help with tone and tightness from their spasms. Some parts of my body is beginning to lock up. So it's time to pay attention to that. Now, tone and spasms are the same thing. The more modern word is to call it tone. The more common word is to call it spasms or spasticity. So it's a tightening of the muscles, either one. I try to say both because I try to be modern, but then not everybody knows the new terminology. So, we just have to work through these things. So if you're having that tightness, first of all, you want to think about your tone. Are you using it to your advantage? Because if you use it to your advantage, you might not want to get rid of it. But if it's getting so bad that your joints and your muscles are starting to lock up, it's really time to pay attention to that. So some people will use their tone to help them transfer so that they can do a standing transfer. And, they'll harness their tone if it's pretty mild or kind of medium, if it's not bothering them otherwise, they'll harness that into some functional activities. But most people have toner spasticity, and it's really bothersome to them. Like this person, that their body's beginning to lock up, and we don't want that. We want those joints supple, we want those muscles supple, because when the body starts locking up like that, the muscles are getting more taut, which means that it's more difficult for them to straighten out, and it can actually lead to contracted joints where you can't straighten the joint out. And then sometimes splints have to be used to progressively take that contraction and to slowly, over months, weeks, a lot of time, to straighten out those joints. Or sometimes surgery has to be done to loosen those up. So, this is really something to pay attention to. Now, with a mild amount of toner spasticity, that range of motion that you do, those stretching exercises that you were taught in the rehab hospital, that is probably one of the first things that people are like, I don't need to do this. It takes up too much time. I just lay here while somebody moves me. It's boring. I'm not going to do this anymore. Okay, that's a huge issue. That is probably one of the best things that you can do for yourself, or have someone do to your body, is that stretching exercise, because it keeps everything supple. When you use a wheelchair and you're seated all the time, your hips are at that 90-degree angle. Your knees are at that 90-degree angle. And so all during the day, you're sitting in that, those muscles are tightening. So you want to be sure and straighten everything out, get your joints all in motion, do those exercises. It not only helps reduce the tone because it fatigues the muscles, so they're not as anxious to knot up again. So that's very helpful. It also helps to stir up your bladder a little bit. You know that old song, the leg bone's connected to the knee bone's connected to the thigh bone, that song. Well, your muscles are all work together too. So when you're moving your legs, you're shaking your abdominal muscles, and that's shaking that bladder up. So that helps reduce urinary tract infections. Another thing that when you engage those abdominal muscles is it's helping your bowel program, because after paralysis, your bowels, and just even sitting, people who don't have paralysis, that just sit a lot through work, or maybe they're elderly, so they don't get around and move around as much, the bowel tends to slow down because it's relying on that muscle tone to help move the stool along in the bowel. So it helps with that as well. Also, when you exercise, in particular your legs, now you need to do your arms if your arms are affected by paralysis. If you have had a stroke and only one arm is, you need to have that one side exercised for you. Your other one you can do on your own. But looking particularly at the legs, you've got really big muscles in your thighs, huge muscles in your thighs. Now you have similar type of muscles. The arms and the legs are kind of anatomically comparable, but the arms are so much smaller. So when you look at these huge muscles, if you look at your thighs, they go from your hips all the way down to your knees. So when you're exercising that, you're metabolizing more, which also helps prevent adult onset diabetes, which happens to people who are immobile, who are paralyzed, who are spending a lot of time in the wheelchair. It doesn't happen to everyone, but it is a secondary complication. So you want to move those thigh muscles around. You want to exercise those. If you can do it a couple of times a day, all the better. But moving any part of your body that's paralyzed is critical to keeping everything all supple in your body and avoiding other complications. Just exercising your body helps that blood flow and that circulation get down to your feet, maybe into your hands, to help reduce edema, help put that fluid back to your body. Just doing the exercises, hopefully it will help build some muscle. It's pretty challenging to build muscle just through doing manual exercises like that. But the more exercises that you can do with equipment like functional electrical stimulation or standing, it helps build muscles. The more muscles you have, the less risk you have of skin breakdown, because when your bony prominences rest on a nice tissuey muscle, it's kind of a natural cushion in your body. If it rests on a real thin muscle, that's when you tend to get more of the breakdown. Now, you can get breakdown at any point in time if you're not doing those pressure releases. So, but they're just the mental fact of moving your body can help your mental well-being. It's just everything about it. So moving your body is very, very, very important. So that is one thing that you can do. Now, very popular today for reducing tone and spasms currently is the Botox injections. And a lot of people will do that. Now, there's oral medication. If you have a lot of toner spasms throughout your body, you can take oral medications. A lot of people don't like taking that because it affects every part of your body. So some people say it kind of makes me foggy because it's relaxant. It's relaxing your muscles. And so people kind of get, they kind of get this foggy brain and they're like, oh, I just don't like the feeling that I have on that. And that's one of the reasons why Botox has become so popular, because you're only affecting the muscles that need to be affected. So if you take a pill, you're relaxing your arm muscles. If they're not paralyzed, you're still relaxing the arm muscles because it travels throughout your body. But if you take the Botox and say you only need it in your legs, then only the legs are being treated. So it's kind of a win situation. So a lot of people have gone to that. Now, some people don't like injections and they have a needle phobia, so that can be hard to overcome. Some people don't like that they have to keep going back and it has to be repeated every 4 to 6 months because your muscles grow back. And so, they have little tiny injections that go in different spots in the muscles, and then that muscle grows back. And so you have to have it repeatedly done. And some people don't like that. But of the two, people generally like the Botox much better than they like taking the oral pills. Now, you can still take the oral pills. If that's working for you, then that's what you need to do. Everything is so individual. Just because everybody else likes it doesn't mean you have to like it too. You can do whatever you want and do what's best for you. Then we go up in the hierarchy of care. If the medication's not working, if the Botox and, there's just too many places where there's spasticity and that's just not working out, some people will have a pump put in. It's a little pump that goes in the abdomen. It's about like that big. It's literally about that big. It's very thin. And they can inject medication into that pump. They just, the pump's under your skin in your abdomen. And they can put medication in there. They just put a needle in there and there's a port inside the pump. And so it just goes through the surface of the skin to that pump. And then there's a little tube that goes from the pump around your body and goes into the spinal column, not into the spinal cord, but it goes into that part of the vertebrae where the spinal cord is within those little bones on your backbone. So it goes in that space. And it delivers the baclofen into your spinal fluid and it bathes that spinal cord so it relaxes. Now, most people have it done in their lower back. It can be done up higher in the neck, but you have to be careful about that. You have to go to an ultra specialist to have that done, because the Botox chemical that they put in the pump is a much higher dose than you can take in oral medication. And it's heavier than spinal fluid. So it stays low in your spinal cord. So you have to be careful. If you have a lot of tone in your arms, sometimes people will have it injected up higher. That's where you get the ultra specialist to be able to do that. Because if it gets too high, it can affect your breathing. So people who know what they're doing can do it in the upper spinal cord. Most people have it done in their lower spinal cord, not in the cord, but in that intrathecal space, it is called. And so it just bathes that spinal cord and helps relax. So a lot of people find good results from that. Interestingly enough, if you'd elect to get one of these baclofen pumps, you used to have to go through a test. And they would just put a needle in like a lumbar puncture and test the baclofen, see if it would work. They don't do that anymore. so people who had that would have the test, they get relief, and they'd be like, no, 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 I don't want to wait to have the surgery to have the pump put in. I want it right now because this relief is wonderful. And so they don't really do the testing anymore. If you're eligible to have one, they just put them right in. So that kind of has helped with the process. But, they had to make sure, and I don't, payers were like, well, we don't want to put them in if it's not going to work. Well, it works. It works. So that all has been demonstrated now. So they just do it they just put them in now. Also, if you have a problem with neuropathic pain, they can combine the baclofen that goes in the pump and medicine for neuropathic pain in that pump. They can give you both that same medicine that helps control the pain and the transmission through the spinal cord. So it's really good for that as well. You can have it just for baclofen, you can have it just for pain, or you can have it for a combination of each. So it's kind of a nice thing if you need that sort of thing. Now, this person is not at that point. It's just beginning to lock up. So I'm thinking with exercises, it might just resolve your issue. If the contractions get so bad, you might need to go to one of these higher level things. Now, people who have so much tone that they're actually flung out of their wheelchair, you'll see some people have seat belts because their tone's so bad that they will just flip right out of their chair with it. Or they have such pain with it, or they have so many problems with it. There are surgeries, and they can do different injections of numbing medication around different nerves. But those are much higher level treatments. So that's usually the progress of how that goes. So you won't need that if you get those tone or spasms under control, you don't need to advance to those other kinds of things. There was a question in here. Oh, this is lovely. Connie, I love it. You have a name of an actress on TV. Okay, so she went to a Goodwill outlet to weigh herself. She also bought a roll-on at-home scale. She needs assistance with the roll-on at scale as it has a lip. Isn't that too bad? But if you go to any place that's measuring any kind of freight or a manufacturer, people want to help other people, and people are very lovely. Now, we all run into people that are grouchy. Okay, fine, move on, go to somebody else, because people are lovely. I love that, going to the Goodwill. Here's another question. They're having symptoms of AD after 40 years. Para T5, is this possible? Never had it before. Well, yes, Brian, it is possible. Some people don't have symptoms of AD until they hit that aging process, and things in their bodies just naturally change. And they're like, wait a minute, hold the phone. I've never had AD. What's going on? But this does happen. So be sure you have that AD wallet card from the Reeve Foundation to keep with you at all times. So if you have a problem with your AD and you can't get it resolved at home, doing the things like checking your catheter, sitting bolt upright, when you sit up bolt upright really fast, your blood pressure is going to drop, and that's treatment for AD, is getting that blood pressure to drop. If you continue to have problems with your AD, you can get nitro paste. It comes in a tube, and there's a little measuring sheet that comes with it. And then you say, you can have 1/2 inch, or you can have 1 inch. You put it out like a tube of toothpaste, and you just put it up on your forehead, and that helps drop your blood pressure. Nitroglycerin pills, there's other medications. But if you do, I wanted to mention that if you do the paste, when your blood pressure comes down, you want to take that off, and you want to wash your forehead, because you don't want to keep giving yourself more and more medicine once the problem is resolved. But get those, anybody who has AD or suspects that they could have AD, we usually say it's from T6 or above that you're in the range that you could have AD. But a lot of people down in the T10 level are having AD now. So we know a lot more about it than we used to. So if you are in that range, be sure you have those wallet cards. They are made for you, that you'll know what to do. They have all the symptoms. So everybody knows the symptom of the pounding headache. They're taught the pounding headache. If you have the pounding headache, you have AD. But there's also other things, more milder forms, like some people have goosebumps. Some people have fuzzy vision. Some people get a stuffy nose. This can all be mild symptoms of AD as well. So be sure you have that wallet card because it can help you. It can also, if you have to go to the hospital because you can't get your blood pressure down and you can't figure out what the source is, you check the catheter, the urine's flowing, you check the valve, there's no impaction. Sometimes it can be from the skin just laying on a wrinkle. I know somebody who got AD from wearing Levi's, not to point out a brand, it can be any brand that has the hard rivets, and they were sitting on those rivets, even on their pressure dispersing equipment, gave them AD. I know people who use their computer that get AD. So there are all kinds of symptoms. There are people that even have AD at night when they're sleeping and they have no symptoms. So always know what your average blood pressure is. If you have to go to the hospital or if you have the emergency, if you have to call 911, that AD card has instructions for the healthcare professional, very professionally written, so that they'll not be offended by it. But you can say, I think it's this, pull out that card. It has the references on it to scientific literature, all for the physicians. So always keep those, no matter where you are, have one handy. They'll send you some and you can carry it with you. Always have that with you. There's also a card for sepsis and deep vein thrombosis. So get all of them and keep all three of them with you. So why after 40 years is this happening? Well, it's probably something to do with aging and your body's changing. It could be that maybe you're developing a pressure injury or something has gone awry in your body that you can't see yet, because pressure injuries develop on the inside way before you can see them on the outside of your skin. So, it could be maybe you've started using the computer and you're having problems with the light. I had a gentleman who was using his computer next to his refrigerator in the kitchen. And when the refrigerator would come on, that extra generation of electricity would cause him to did something to the computer light, and it would not flash so that you could see, but there would be this change in light on his computer screen. And he found that if he wore a baseball cap and sunglasses, and I forget what else he did, I think a third thing, then he didn't have that problem. And I'm like, well, you're having AD. No, I've never had AD and I don't have the pounding headache, but my nose runs and my eyes get all fuzzy and this is happening. Well, turned out he was having AD. And he moved his computer into the living room and all of that stopped. So he got rid of his trigger. And so that happens. So when you start having symptoms of AD, if you haven't figured out what the trigger is, keep a little notebook with you, Brian, and write down, I had an AD episode at such and so time, and I sat up and it went away, or it was my catheter was clogged or something, and keep a little list. Because sometimes if people know their triggers, then they don't have to take the medication for it. They just know, don't let that trigger, and so they take care of that. Here, Connie had AD continued for months after fracturing my knee. Yes, that happens. For her, it was sweating. So, there's all kinds of symptoms of AD besides that pounding headache. I have this one gentleman, and I'm not going to call out his name, but I just loved him to pieces, because talk about a body of steel. He was out trimming some trees and he fell out of his wheelchair. And so he had to call his son, and his son was coming to get him back in the wheelchair. Okay, fine. But while he was laying there, he thought he'd just take the trimmer and trim the grass a little bit. I mean, talk about a strong individual. And it wasn't until he wasn't feeling well. It wasn't until he got in ready for bed that night. He looked down and he had broken his leg and it was all swollen, but he didn't notice it until it took his clothes off. And so, but I thought, what a hardy guy. And I thought, no wonder you're so successful. I consider everybody who has that spinal cord injury that's listening today or that has lived with one, you're successful, you're making it. So that all works out really well. So yeah, there's all kinds of things that can trigger AD that you just, the list continues to grow. Let's put it that way. Here's a person that they've had a T12 L1 a spinal cord injury for 18 years. His hips are deteriorating, I think from so many transfers. The pain management doctor suggests a spinal stimulator. Do you think a spinal cord stimulator would help hip arthritis pain, or should I consider hip replacement? Well, that is something that, you're going to have to work out with your healthcare physicians. Although, now I will say this, we are seeing a lot of problems with hip from people who have had injury for a number of years because they haven't been on the correct seating equipment. And the reason why they haven't been on it isn't because somebody did anything wrong. It was because people didn't know that it needs to be a certain way. So be sure and check your seating equipment. So we used to put people just on flat cushions, and then they kind of sink down into the cushion just a little bit, to keep that positioning. Now we're looking at much more of a cupped position because your hip socket is sitting inside, that ball socket sitting inside the joint in your pelvis. And when you're sitting on that kind of flat cushion, not like a more very small rimmed cup, not that it comes up, high up on your body, but when you're sitting like that, this tends to kind of, when you're sitting on a flat one, it tends to kind of pull out a little bit. So we're learning that just, recently. So, we're learning new things all the time, and people are living, normal life expectancies. So if these things happen, arthritis happens to people. So which do you think would be better? It just depends on your hips and how bad the arthritis is. You want to consider it's surgery. Would you rather have the spinal cord stimulator if it's one that can be placed on the skin, or again, do you have to have surgery to have it put in? We try to avoid surgery. Everybody should try to avoid surgery if you have a spinal cord injury or any kind of paralysis. Just if you're anybody, surgery is not the kind of thing people have gotten so glib with surgery. Oh, I'll just have this fixed, or I'll just, you watch TV and all these stars. I had this nipped, I had that tucked, I had, all this work done. It's like surgery is not something that you want to strive for. It's not something you should think about second nature. You're going to have anesthesia. That can be dangerous. Now, most surgeries go without a hitch, but if you have problems like spinal cord injury, sometimes it can be hard to get off the ventilator. Some people come out and even though they've had pressure dispersing equipment on the operating table, they weren't turned, or, they couldn't be turned, and they might have a pressure injury. So, you just kind of have to be careful about all these things. And so anyway, what you decide to do is really going to be up to you and the suggestions of your healthcare professionals. But would the spinal cord stimulator help with hip arthritis pain? It should, because it should help that pain. So if you can get one and try it on the surface of your skin first, see how it works. No harm, no foul. That's pretty easy. But if you have to have it implanted, then you might want to think about it. It can be minimally invasive surgery, so it can be pretty, not too much risk. But you need to look at all those options and talk to your spinal cord injury specialist about what they think about your risk of surgery would be, because, there's DVT, blood clots, there's, these are the risks for everyone. But being that you might have paralysis, then, the risks are a little bit greater than for the average person out there. So weigh all those risk imbalances. Here's a person that's T12 paraplegic and now getting recurring urine infections. My urine smells bad, so can you point me in the right direction? So this is the thing about urine. There's so much coming down the pike about urine and bladder control. And we are in this renaissance of all this medical research coming to fruition. And one of the things that's coming up are these transcutaneous, which means on the skin, no surgery. You take a long strip of tape. It has electrodes in this piece of tape. They put it over your spinal cord. They turn the stimulator on, and it can help with bowel and bladder function. Some people are even getting to the point where they're starting to recognize their need to toilet. And so they can either go in and catheterize, or if they're incomplete, they can go, they don't have to do it so much on timing. They just get the sensation, and then they know they have to go. There's some new devices that are going to come out that, your phone will call you and say, your bladder's getting full. It's time to go to the bathroom. So there's all these things. Also go back and look on the YouTube for the interview that I did with Dr. Susanna Grouch, Grouh. Fabulous conversation about UTIs and about how we shouldn't be always treating every single UTI, that maybe a little black bacteria in the bladder is not abnormal. But it sounds like you're having these recurrent problems. Now, it seems like there are some people that do everything right and they still have bladder problems, and other people just don't bother with any of the preventions, and they don't have a UTI at all. So why is that? So people have been looking at that, and it seems like some people's autonomic nervous system, that part that happens automatically, where it looks at invaders in the body like bacteria or viruses, that autonomic nervous system has been more affected in some people and not so much affected in other people who have the same level of injury. And why is this? And nobody knows. So it's probably a factor of the autonomic nervous system. Again, with aging, sometimes things don't work as well as they used to. And so it could be a failure with that, and why more has gone on with that. So be sure you drink your fluids. Water is best. If you're on a bladder program, which I would assume that you would be at T12, I would assume you're catheterizing. So you have to maintain that fluid limit so you don't go over and get too much urine in your bladder and blow out your kidneys. That's the big problem. That's why we have those fluid limitations. But water is best. Caffeine is not so good for your bladder. I'm not saying stop your coffee right now, because you'll go through caffeine withdrawals. Yes, it makes you withdraw. So you have to wean off that. Some people just will limit themselves to a cup in the morning. Some people drink it all day, which could be a problem. Sugary drinks, sports drinks, diet sodas can have the same effect as the ones that have the sugar in them. So you have to be careful of all these things, but that will help you. And then look forward to this coming year where these spinal cord stimulators are going to come out, and that's going to help shake things up, move things around, get those muscles like I was talking earlier. Be sure and do your exercises. These spinal cord stimulators help stimulate the bladder muscles and the bowel muscles. So keep in line with that. Now, I sound like I'm pushing these things, and I'm not pushing these things. But for some people, this is going to be very helpful. I just want you to consider these things. I'm not saying please run out and get one. I'm just saying please consider these things, because if it can help you, that might be a good answer for you. Some people are all on board the research train, and they're like, get me in this trial. I want this stuff right now. Some people are like, well, let me see how it goes. And that's a good option as well. And then some people are like, no, I'm not at all interested. And that is fine too. You don't have to be interested. You don't have to find out about any of it. But if you have a problem and there's something that might help you, read about it. There's a lot of companies that are coming out with them. Spinex, Onward. What is the name of this company? I have their publicity, Anuvo. There's a company in London that's coming out with these transdermal spinal stimulators. What they're doing is they're planning to, and when I mean coming out with them, I mean going to market. I mean, you can go to your doctor and say, I'd like to try one of these. the insurance, I imagine there'll be letters back and forth, but they're getting trying to get insurance approval on these, and I think that is a part of going to market, because if nobody's going to pay for it, that's a problem. But they're getting insurance approval, they're getting FDA approval, they're getting all these, they're doing all the work. And there's one that's going to come out for the pediatric population in January. And then in the first quarter, they're coming out with some adult versions of these stimulators. And all these companies are going to be releasing in the new year. Forbid if we don't have another COVID or some major catastrophe. It's so close, you can almost touch it. So whatever you decide you want to do with your life, that is your decision. But it's always good to have the information about these things, because maybe you just want to wait a while and see, or, just want to see what's going on. And if you're not interested in it, fine. That's just fine too. You're happy with the way things are for you. That's just fine. So, whatever your choice is works. Somebody's looking for an air mattress for her husband. He's had one pressure wound when he was first injured 6.5 years ago, but they want to avoid any further wounds. Well, there's all different kinds of pressure injury mattresses, or pressure dispersing mattresses. And so talk with your therapist or your husband's physician to see which one best matches his body habitus. So people who are larger or people who are thinner, over or underweight, are at higher risk than people who are at normal weight. Or if you're a person who has had injury before, that skin's not as elastic as it was before. And so you want to have a higher level of pressure dispersing equipment. So the Roho is nice. There are some air-filled ones that are nice. There's some that move the air around. So like this part of your body goes up and this part goes down a little bit. You still have protection, but it kind of rotates it. Whatever kind you decide that you want to get is going to be fine, as long as you still do turning. So people think, oh, I'm on a pressure reducing mattress and I can just lay here all night. No mattress is magical. You still have to turn. And so that can be an issue, because you still have to turn. That's just the way it is. And so I'm sorry to say, in pressure injury, people always never like the treatment. You have to stay off of it if you have a pressure injury, and you need to do your pressure releases. And so you'll be fine as long as you get a good mattress that matches the needs of your husband, and you still turn at night. So if maybe because he's had that pressure injury before, insurance might opt for a higher level mattress. So, but your physician will have to write probably a letter of medical necessity to get a mattress that will be suitable for him. So you'll have to go through that process. Okay, so there's a question about bowel and bladder care. We've got the bladder management toolkit up there. So let's talk about bowels, because there's a person that's writing in about, should it be the same process for incomplete and complete injury, people with complete and incomplete injuries? Well, first of all, let's talk about a complete injury. A complete injury means that messages are not being able to get from one end of the spinal cord to the other. That is what a complete injury is. It does not mean your spinal cord is severed. There are still people who believe that. There are healthcare professionals who still say that. It is a terminology that means that the message is not able to get completely through. It's a terminology issue, which is very unfortunate. But, when these things are devised years and years ago, it just wasn't thought of that way. But people say, oh, complete injury, your spinal cord is completely severed. No, it is not. There are so few people that have a completely spinal cord severed cord, it's impossible almost to even find them. They're out there, but it's so very, very rare. So the incomplete means some messages get through. So if you're incomplete, you might still need the neurogenic bladder or bowel program. So it's based on, the bowel programs are based on the completeness of the injury. And people who have complete injuries usually go on the bowel and bladder program, no matter what. The upper bowel program for those people that are like T12 and above, it's called upper motor neuron injury. So it depends on how much motor nerve injury you have with an incomplete. But the people who have complete injury in the upper part in their neck or in their thoracic region, the part where your ribs come out of the vertebrae, those people go on the upper motor plan. And that is because they have tone, and which is spasticity in their body, which is also in their bowel. And even if you don't see it on the outside of the body, it could still be in the bowel. If you see it on the outside of the body, you can presume it's in the bowel and bladder as well. And so those people do the suppository or the mini enema every other day. And then they do digital stimulation with a well-lubricated glove. And don't scrimp on the lubricant here, because that tissue inside the bowel is very delicate. And then the bowel is expelled. Sitting up is much better than laying in the bed. If you have a medical condition and have to lay in the bed, you want to lay on your left side. But if there's any way possible you can sit up, you want to ask for a commode chair with the correct adaptive equipment for the person. So if they need a headrest, if they need armrest, you need to ask for that with a pressure dispersing seat. And good brakes, really good brakes, so they can transfer onto that equipment. Now, the lower motor neuron usually just does a digital stimulation. And I say just does that only because it's a lot simpler than the more complicated. If you have a lower motor neuron, that's generally in the lumbar or sacral area, the spinal cord. And so that leaves the body without tone, which means that internal sphincter that you're trying to open with the digital stim in the upper motor neuron program and the lower motor motor program, that inner sphincter, not the one you see, the one that's further higher in the rectum, about a finger's width, which is why we use the finger. That one has no tone, and the stool will just come running out. So sometimes people will just do a quick dig stim once a day and they're fine. They don't have any incontinence in between. Sometimes people want to do it maybe more than once a day, and that's fine too. If they're nervous about having an accident or something. For the bowel, you want to follow a healthy diet. Think about our ancestors. Back when they were hunters and gatherers, they were walking all the time. So they had exercise, they had movement. So you have to have that exercise to help your bowel move. It's the way our bodies are made. They ate nuts and berries. Now, our diet is certainly much different now, but those nuts and berries were roughage. So you need to have a lot of roughage. You need to have that fluid in your body according to your bladder program and how much you can have. If you don't have any restraints, you can do a little more fluid, but have fluid, especially water, because that helps. Some of that water goes into the stool. That stool is passing very slowly in the paralyzed bowel, but the bowel is still taking fluid out of the stool, so it forms stool. And so, because it goes in they call it chyme. It's kind of a thick sludge. It goes from your stomach and goes through the small intestine, makes kind of a thick sludge. And then the large intestine's taking fluid out all the time. So the longer the stool stays in your intestines, the drier it gets, the harder it is to pass, the harder it is to move along. And you have to do the bowel program. Sometimes people will write to me and say, I just don't like doing it, so I just didn't do it. And now I have this impaction. And it's like, well, yeah, that's what happens. You have to do it. I have yet to meet the individual that says, oh, goody, I get to do a bowel program. I've been waiting for this. I mean, nobody likes it, but it's now a part of your normal, and it just becomes second nature. You do it and you just move on. There are some new devices out that will help you. You want to avoid tap water enema or any kind of enemas, because those flush out the bowel, which destroys the natural flora that's helping break down that stool. It kind of affects those little tiny fibers, the cilia it's called, in the bowel, kind of washes those away. And so those make the bowel program so much harder. Those don't use the natural movement of the bowel. So you want to keep your bowel healthy. You want to keep it working. You don't want to have that removed later on. Some people will opt for colostomy. And I always find this interesting as well, because they say, well, for my caregiver, it'll be so much easier than doing the bowel program. They just change the bag. And then I talk to the caregiver and say, I'd rather do the bowel program than change the bag. The bags are hard to stay on. They sometimes pop off. There are people that have had the colostomy that love it. There are people that have had it that don't. There are people that have had the surgery and have had very bad outcomes. So that's a big decision. But there are other devices. I want to call it the Pristine, that is a little flush thing. It's a lot of equipment that has to be cleaned, but it kind of looks like an enema, but it's not. It doesn't have that much fluid that goes in, and it just washes out the lower part of the bowel. It doesn't travel, through the whole colon itself. And it's kind of tricky to use, but they have a whole staff that will help you do it. If you travel, you've got to take all that equipment with you. So, there's all these things. The big thing for the bowel program is you have to do it on a routine basis. So if you empty your bowel in the morning at 10 o'clock, it has to be at 10 o'clock. It can't be at 11 o'clock. If you're doing it every other day, you have to do it every other day. We used to call the bowel program bowel training, and we would train the bowel to work. Then we got fancy and called it the bowel program, because we wanted the emphasis to be on the activity and not the stool coming out. And so I think that when we called it the bowel training, people kind of got the message that I have to do this because your bowel gets trained that it's going to empty at that time. So that's the way that works. Here's a question. Okay, this is very important. This is the last one on my list, so we'll go with that. Why do disabled people have to pay for their own supplies when visiting Interior Health Clinic? I don't know Interior Health Clinic, but I know a lot of people have to pay for their own supplies when they go to different facilities or when they do different things. Why is that? I don't know. Maybe it's maybe they think it's less expensive, or maybe because people all use different kinds of equipment, maybe it's impossible for them to have in stock every single piece of equipment. Maybe they just don't want the billing management of the equipment to go on. There's 1,001 reasons why it doesn't happen. But this is something I do know. It happens to a lot of people, and equipment, bladder equipment, bowel equipment, getting some of the newer equipment. It's such a challenge. And sometimes you really need something and you have to go through that petition with that letter of medical necessity from your healthcare professional. You've got to go through that process with that letter. And then first time it's always rejected. And then they have to write back, and then there's only a window of time that that the insurance allows it, or the case is closed. There's so many nuances with these things, and it's so difficult. And people are always looking for how can I get supplies? What can I do? Well, it's a huge problem. So please, everybody, if you would, and I do recommend this, look on the Reeve Foundation. There's an advocacy group. You can be as involved as you want to be. They will send, if there's a bill that's going through Congress, they will send you a form letter through your computer that you sign. You can personalize it any way that you want. And it's good to do that because they do read these letters. But even if they just get the form letter from you and your senator or your representative sees that all these people want this particular bill passed because they need equipment or they need services or, whatever it may be, it's all stuff pertaining to people with paralysis from the Reeve Foundation. So be sure and sign up for those, because it makes a difference and it's so easy to do. And then your senator or representative will send a response back to you about what they're doing about that particular bill. Now, they're probably form letters that they send to everybody, but at least they pay attention to you and they are listening to you. And that's an easy way. So you can get on that system and listen to what they have webinars every once in a while, so you can kind of educate yourself what's going on in Congress. Senators and representatives will have meetings, they come home to the area at the time and they will say, we're having this meeting and, come meet us at, I don't know, this particular area, and you can go and talk to them. You can make appointments and talk to them when they're locally with you. You can go to DC and you can meet them in your office out there. That's kind of a fun thing to do. I've gotten to do that a couple of times with some different groups, and it's really very exciting. If you get turfed off to this senator or representative's assistant, say thank you very much, because they're the ones who are assembling the body of work to inform the senator. It's nice to be able to talk to them one-on-one. It's nice to be able to meet them. It's positive to be able to do that. But if you get their assistant, it's almost sometimes even better, because they're the ones who are going to be writing the report for the senator. They're the ones who are going to be putting this bill together and providing the information. They're the ones who are going to say, yes, I talked to so-and-so, and this was an interesting story. We can highlight this bill with this story. So these are all important things to do. And people think, oh, nobody's paying attention to me with that, but they are. And go back, always be nice, always be very friendly, always be, very professional, but keep going back. Write to them one time a month, write to them every couple of months. They'll get to know you. They'll get to know what your issues are. And then you can find out how interested they are in helping you and your cause. So I sent a letter to my senators and my representatives, and I got the letters back, and two of them were very positive, and one of them was not so positive. And it was a form letter about something else. And I had sent the letter because I was in this position when my husband was very ill, and finding finances, and the bank account was dry, and it was, and something needs to be done to help people who are disabled in their families that are trying to pull all of this together. And I got this response back from one person that really was not, I don't know, it just was not favorable. I'll put it that way. And I thought to myself, well, I'm very happy that you're all for right. It was all about right to life and abortion. And I don't want to bring that up, because I don't want to bring that politically into the conversation, because that's not what this story is about. But that was the answer I got. I'm all into right for life, and I'm going against abortion. And I thought to myself, well, that's fine if that's what you want to do and that's your interest. And but that was not my situation. My situation was my husband, and didn't he deserve a right to life? He was still working age, but couldn't work. And didn't he deserve that right to life? Well, I believe he did. And so I campaigned against that person from being reelected. Of course, they were reelected, but I still campaigned against whoever it is. So, you get to know your person, and it helps you decide, how am I going to vote? How am I going to tell my friends, this happened? And, you can influence people in your circle. So these things are important to do. So I highly recommend that. There are some other questions here. would an implant of a suprapubic catheter in the bladder solve the problem of the UTIs? If there's a UTI in your bladder, it's probably going to stay there. People who have suprapubic catheters or any kind of indwelling catheters historically have had more infections than the intermittent, which is why we do recommend the intermittent when at all possible. She said that she had a friend that had UTIs that all disappeared after the surgery. Sometimes things happen for some people and other people, but it's not necessarily that if you get a suprapubic, the UTIs will be gone. It is a higher risk that you'll still have them. Fortunately for your friend, that did not work out that way. The question about, is the colostomy permanent, or can it be reversed if the person does not like it? I prefer to go back and prefers to go back to the digital stem. Well, a colostomy is not something you want to try for a while and see how it goes. This is a pretty big surgery, but elective colostomies usually can be reversed. And with the advent of the electrical stimulation that is helping in the people who have done it in the research has so dramatically changed their valve programs. I think before jumping ahead to the colostomy, I think myself personally, I would try one of these electrical stimulation devices on the skin because it has made such a huge difference in people's lives. But elective colostomies can be reversed. It's another surgery. It's a lot. It's a lot to reverse them. It's a lot to have them. So those are some issues you want to think about. Do some healthcare facilities need more education on disability awareness? Yes. I know in nursing programs and in medical programs, people do get classes on paralysis relating to different diagnoses. And so they do have that, but because it's really so few and far between, people who work on neural floors used to see a lot more stroke than they see now because of the clot buster drugs that they have. Spinal cord injury is extremely rare. And so it's really wise to go to a rehabilitation opportunity, if a rehabilitation center, and find a rehabilitation specialist if you can. So I'm seeing, Beth, did you want to add some more information? No, I think so. I see a new notice on there and I'm not sure exactly what it means, but I'll find out before.
No, I'm sorry. I meant to send her the link to becoming an advocate and I clicked the wrong button.
Oh, okay. Okay. I had never seen that little notice up there before. And I thought, oh, but you're welcome to it anytime. So anyway, we're at the top of our hour. And so I thank you for coming today. Now, don't forget, if you're in the Dallas area this Saturday or Friday, Saturday, and I think it goes on Sunday. It goes on Sunday as well. The Abilities Expo we have coming up in the second Wednesday in January. So it's a ways off yet. We're going to have an announcement about one of the new transdermal stimulation that's coming out for the pediatric population. So you'll want to be sure and tune into that. Even if you're not a pediatric person, tune into that because it will be the similar device for the adult people, which is coming out just a little bit later. So if you're adult or pediatric, it will be well worth that because we're going to have the big unveiling. So be sure and tune into that. Mark your calendars. So thank you for coming today. And I look forward to seeing you next month in December. Whatever holiday you celebrate, I hope you have a good one.